Eye diseases, diabetic retinopathy. Diabetic retinopathy overview. Many people with diabetes develop a problem with their eyes called diabetic retinopathy. Diabetes damages the small blood vessels in the retina. This is the part of the eye that captures images and sends the information to your brain. Diabetic retinopathy can lead to poor vision and even blindness. You can help avoid damage to the retina by keeping your blood sugar and blood pressure levels near normal. This can slow the progress of retinopathy and prevent vision loss. Diabetic retinopathy is a progressive condition. During the early stage, the tiny blood vessels in the eye weaken. The blood vessels develop small bulges that may burst and leak into the retina and into the gel-like fluid inside the eye called the vitreous gel. As the condition progresses, new fragile blood vessels grow on the surface of the retina. This is called proliferate retinopathy. These abnormal blood vessels may break easily, bleeding into the middle of the eye and clouding vision. This bleeding can also cause scar tissue to form, which can pull on the retina and cause the retina to detach from the wall of the eye, which is known as retinal detachment. Symptoms. Symptoms occasionally occur in the disease, but typically they are not noticed until significant damage has occurred and complications have developed. Regular screening exams can identify diabetic retinopathy early in the disease and can help prevent vision loss. Complications of diabetic retinopathy include swelling in the central part of the retina, macular edema, and retinal detachment. If the disease progresses, permanent damage to the retina and other parts of the eye can develop, leading to severe vision loss or blindness. Causes of diabetic retinopathy. Diabetic retinopathy develops when high blood sugar damages the tiny blood vessels of the retina. These blood vessels weaken and develop small bulges which may burst and leak into the retina. Later, new fragile blood vessels grow on the surface of the retina that may break and bleed into the eye, clouding vision and causing scar tissue to form. Prevention. You can prevent vision loss because of diabetic retinopathy by keeping your blood sugar levels and blood pressure near normal. This can help lower your chance of developing damage to small blood vessels, which decreases the risk of damage to the retina. It can also help slow the progression of retinopathy if it is already present and prevent future vision loss. Experts believe that many causes of vision loss and blindness could be prevented with early detection and treatment and careful long-term follow-up care. Treatment. There is no cure for diabetic retinopathy. However, laser treatment, photocoagulation, is usually very effective at preventing vision loss if it is done before the retina has been severely damaged. Surgical removal of the vitreous gel, vitrectomy, may also help improve vision if the retina has not been severely damaged. Because symptoms may not develop until the disease becomes severe, early detection through regular screening is important. The earlier retinopathy is detected, the easier it is to treat and the more likely vision will be preserved. You may not need treatment for diabetic retinopathy unless it has affected the center macula of the retina or, in rare cases, if your sight, peripheral vision, has been severely damaged. However, you need to have your vision checked every year. If the macula has been damaged by macular edema, you may need laser treatment. Surgical removal of the vitreous gel, vitrectomy, is done only when there is bleeding, vitreous hemorrhage, or retinal detachment, which are rare in people with early stage retinopathy. Vitrectomy is also done when there is severe scar tissue formation. For more severe retinopathy, you may need either laser treatment or vitrectomy. These procedures can help prevent, stabilize, or slow vision loss when they are done before the retina has been severely damaged. Treatment for diabetic retinopathy is often very effective in preventing, delaying, or reducing vision loss, but it is not a cure for the disease. People who have been treated for diabetic retinopathy need to be monitored frequently by an eye doctor to check for new changes in their eyes. Many people with diabetic retinopathy need to be treated more than once as the condition progresses.